Good afternoon, everyone. I'm very, very happy to have here with me Sarah Myhill. I would say she's one of my inspiration, and I've been following her work for a very, very long time. She qualified in medicine more than 30 years ago, but she's been very, very passionate bringing diet and supplements in treating her patients. And we will try to talk about her own experience today, and we'll try to talk about some of the myths which are still out there, and I will ask her a lot of different questions. That's why thank you so much, Sarah, for being here with me today.
My absolute pleasure.
That's like, tell me a little bit, because obviously you qualified 30 years ago as a wow. Then, oh my goodness, I can't believe that's like 40 years ago in medicine. And obviously, when it comes to medical education, I've spoken with quite a lot of doctors, and they sometimes say to me, "Oh, we haven't learned anything about nutrition, or we had an hour lesson about nutrition." That's how did you decide that, you need to look into the diet?
Well, very early on in proceedings. As I mentioned, I qualified in 81, came out top of the class, and thought I was going to be, the best doctor that had ever been in the history of. And, a few morning surgeries in general practice quickly disabused me of that, because patients always want to know the question, why? Why do I have high blood pressure? Why do I have cholesterol problems? Why am I depressed? Why do I have arthritis? And I suddenly realized that this was not addressed anywhere in conventional medical training. They are not asking the question why. And the reason for that is very simple. Conventional medical training is now dominated by big pharma. Big pharma's mantra is a patient cured is a customer lost. So the doctors are not interested in cures anymore. What they want to dish out is symptom suppressing medication. And that's what happens. And of course, as you know, we have symptoms for very good reasons. We have symptoms because that's nature's way of saying there's something wrong, do something about it. But if you suppress those symptoms, then you suppress you stop people looking for those underlying causes, and the underlying pathology gets worse and worse and worse.
Yeah.
So the more drugs you use, the worse things become. So it's short-term gain, long-term pain. So I did 20 years as an NHS general practitioner. And in the year 2000, I then realized I didn't have the clinical freedoms I needed to be an effective doctor. So at that point, I went into the independent sector, and I've been working independently as a medical doctor since. And we call this specialty naturopathic medicine. Naturopathic medicine has a fantastic history that goes back, for hundreds of years. And it's all about asking the question why. And it started with the Greek doctors, didn't it? Now, we have many more insights into anatomy and physiology and biochemistry as what's going on than they did. But at least those doctors were asking the right questions. Nowadays, the doctors, they're not even asking the right questions. And therefore, they cannot hope to see the way forward, because you only see what you look for. Yep. And if you're not looking for reasons, then you're not going to see them, even if they pass right under your nose. So my medicine has gone, full circle now. I feel I'm back at the beginning again, asking the basic questions why. I know some of the answers, but not all of them. I have never not been on a steep learning curve. So I'm quite I assure you, I don't know all the answers, but I do know the questions. I do know the overall strategy. I do know the roadmap, and then we have to work things out from there.
Oh, that's like a brilliant answer. And I was thinking, how did your colleagues reacted when you started practicing very differently than actually you've been trained?
It was a very divisive time. It's a little bit like the COVID vaccine or COVID. You're either awake or you're asleep. And it's exactly the same in conventional medicine. You're either awake or you're asleep. And the awake doctors have all become my friends, and we have regular meetings and parties and sessions and Zoom and conflabs in order to ask all these questions and find answers. And then we have those who are asleep, and they are simply disinterested. And even when I was in doing my NHS work, I was trying to ask the questions why. I was trying to look for the causes of migraine, of arthritis, of cancer, or whatever. And I was often asked to do postgraduate sessions for doctors, for GPs, to come along and give a talk to a group of GPs, in Nottinghamshire, Leicestershire, Derbyshire, London, wherever. And of course, I always went. And what was a feature of those meetings is I would chat away, as we are now, presenting my experience, presenting the science, not woohoo stuff, but good scientific studies that had showed that these methods are effective. And at the end of the session, then any questions? No, there'd be a deathly silence. Would any of them come up at the end and say, oh, that's really interesting, can you help me? No, they all just walked out. And the reason is because if we ask those doctors to adopt this sort of medicine, ask the question why, it takes much longer.
Yeah.
You can't get rid of a patient in 5 minutes with a quick chat and prescription. They don't make any money because, I'm not selling drugs. I'm not profiting out of any of the interventions I recommend. And, it's intellectually harder work. It's always much more difficult asking the question why. You have to look back at that patient's history and see when the disease started, where they were living, what they were consuming.
Yeah.
Were they being poisoned? Anything? What supplements were they taking? Did they come across any disease? It takes a long time to take a good history. I mean, if I have a new patient these days, I don't even see them for a first appointment. Initially, they send me all their history, all their tests, and I settle down with a management plan. And it takes at least an hour, sometimes an hour and 30 minutes to sift through all the material, look at the family history, look what's gone before, push it all in logical order, work out the mechanisms, and then we can go forward. So yes, it takes longer, but it's so much more satisfying intellectually. You're giving people cures, not go away for a month and come back and see where you're at, whatever. And most important of all is you put that person in charge of their illness. You give them responsibility for themselves. That you empower them to ask the right questions, observe, think, experiment, put in place, and then feel the effects that take place. And of course, there's nobody better motivated than that person that you are talking to who is sick, who wants to get well. When I worked in general practice, I was very aware that I always had two hats on. I had my naturopathic doctor hat, let's ask the question why, let's try this diet, let's try this supplement, let's try this herbal preparation, whatever. And then I would have another group who, as I started to talk, their eyes would glaze over. Yeah. And I was thinking to myself, they just want the drugs and they're gone. And I said, do you just want the drugs and be gone? They said, yeah, we just want the drugs. And off they went. So, but the joy of doing what I do now is people know a little bit what to expect when they come and see me. They know what's on the menu, and so they come prepared. So I don't have that problem anymore. I've always got my naturopathic hat on these days.
Amazing. And then, because obviously I work as a naturopathic nutritionist, and, the way I say, like, I really like what you say, that it's an active role of the patient. I say to them, do you want to be in the driver's seat or do you want to be a passenger? Because when we give a drug to the patient, it's being in a passenger seat, right? And we need to take that responsibility. But it's so right that not everyone is ready. Not everyone has the motivation. And usually it takes them, I see a lot of difficult cases. And then usually it's the people who are really, really sick. They've tried everything else by the time they come to see me. And then it's really hard because sometimes they also come with the thought that diet cannot change that because they've been told that by medical professionals. And in Lithuania, especially that's where I'm from, the medical professionals are very high up on the hierarchy. That's why what that means, there is a lot of respect. And, but that's what my doctor said. And I've heard so many times from my own patients who would say, look, but the doctor said dairy has nothing to do with that, or gluten has nothing to do with that. And then I say, look, guys, let me talk about nutrition and let's leave the medicine maybe to the doctors, because that's not something I'm qualified in, isn't it?
Well, I know, but I mean, and lots of my patients tell me exactly the same thing. But what I always say to them is, ask that doctor, what is the evidence base for your statement? Because they just come out with these what I call narratives.
Yeah.
And so much medicine is narrative driven. Oh, that's what we taught. That's what we're going to do.
Mm-hmm.
But when you ask them for the evidence base for that, then very often they can't come up with something that's biologically plausible, feasible, has been put to the test, and so on. Whereas the joy of what naturopathic medicine is all about is we can find an evidence base for every single statement that we say, and what's more, we can then put it to the test in a logical and biologically plausible and sensible way, and that's called the patient. Because every person who comes to see you is unique, is different.
Correct.
But as I say, the rules of the game are the same. The tools of the trade are the same. I mean, Leonardo da Vinci had the same tools of the trade as anybody else, but he produced something that was very different from what everybody else was producing. So it's up to us to teach, to provide the knowledge and the tools, and then that individual goes and fine tunes that for themselves and for their family and for other people. So and the other good thing about this is it gets around what I call the blame game, because I cannot micromanage every patient that comes and sees me.
Yeah.
They get back to me, what can I have for breakfast? That's not my job. That's your job to work that out. And of course it'd be prohibitively time consuming.
Yeah.
So it gets around the blame game. And what that means is naturopathic doctors, we don't need insurance policies for when things go wrong, because we are not prescribing, we are not directing, we are not imposing regimes. We're saying, these are the options. This is what's logical. I think this is what's going on with it. Do you agree? And if you want to choose that path, then please go and walk it. But it's up to the individual to walk the path and take responsibility. Now, when I was working as a medical doctor, my medical insurance was about £10,000 or £12,000 a year. Now, that automatically makes me more expensive, doesn't it? So, okay, I know I'm not cheap as a naturopathic doctor, but I'm a darn sight cheaper doing it without insurance cover, without the nonsense of reappraisal and revalidation. And that's what we should be looking for. We should be looking for cheap, effective naturopathic medicine that everybody can access.
I agree with you so much. And I think nowadays people are looking this like from Monday to Sunday diet plan. And I'm like, I'm so against it, because what about if you wake up on Monday and you don't feel like having eggs? You want something else. That's like, it's about giving patients the framework, and then they decide how to play around in that framework, isn't it?
And that feeling is very important. I mean, you may be aware of work by Caroline Ingraham, who wrote a book called Zoo Pharmacognosy. And it's how animals treat themselves by sniffing out the relevant remedies. I mean, when they're sick, first of all, they all fast, they stop eating, and then they go and pick at this herb or this remedy or whatever, and that affects a cure. And she gives wonderful examples in her book. But it's the same with humans. If you feel like an egg, it's probably your body saying, I need a bit more protein. If you feel like a crunchy salad, then there may be a reason for that. I mean, this is why pregnant women have cravings, isn't it? Now, what gets in the way of those cravings and those feelings is addiction.
Correct.
And the worst and most pernicious, of course, is sugar, refined carbohydrate, processed foods. Why? Because you get a quick hit from them. And we call it comfort eating, don't we? And it's a double whammy, because you get that comfort eating, that kind of calming effect. And then you get a hit of sugar that gives you a temporary rocket fuel. And that makes for a very addictive process, because you go through the day with sugars and carbohydrates and fruit juice and bags of crisps and chocolate and to keep going. And, and much can be achieved on addiction. I mean, the great artists, they were all addicts in one way or another, weren't they? But it doesn't make for a happy life. It doesn't make for a good life. It doesn't make for a healthy life. It doesn't make for a long life. So addiction aside, following your instincts is also very important.
I absolutely agree with you. And I think if you get constant cravings for carbohydrate foods, usually you can't go well with them, because a lot of the times it's that addiction behind it, isn't it? Then what do you think about this saying, which is so popular nowadays, everything in moderation? I love food industry uses that a lot. What are your thoughts about it?
Okay. When people are addicts, they come up with rationalizations for their addiction. Oh, I've always eaten like this. A guy once came and see me who was well into his 80s, and I started talking about carbohydrates and PK diet. And he said, well, that reminds me of the war when we were half starved and we couldn't have this, and we couldn't have that, and we couldn't have the other. And he went on to say, you can take the man out of the war, but you can't take the war out of the man. And that's how he rationalized his carbohydrate addiction. I had one guy who came to see me who was a consultant anaesthetist. And before he even I could open my mouth and say anything, he said to me, I just want you to know that when I die, I want to take a cow to heaven with me. And that was his way of saying, I love dairy products, don't stop those. So we get addicted to things that we are allergic to. We get allergic to things we're addicted to, and we rationalize that. We make it okay. Oh, a little bit of everything is good. Yeah, but I don't think a little bit of cannabis is a little bit of cocaine is a very good idea. I don't think a little bit of intravenous heroin is a very good idea either. I don't even think a little bit of cigarette smoke is a good idea either. So, of course, we choose these rationalizations, and everybody thinks they're eating a healthy diet. You know, when I say to somebody, you know, and what's your diet? They say, oh, I eat a healthy diet.
Yeah.
Because they've all rationalized that what they're doing is healthy. But that's relative. You know, young people can get away with blue murder. Old people have to be stricter and tougher. You know, one pathology will demand one food, another pathology something else, perhaps. But you know, I say it's personal. But the bottom line is, we have a body, a brain, and a gut that has evolved over hundreds of thousands of years eating a paleo ketogenic diet. And, you know, our bodies and our brains don't change that quickly. You know, our diets have changed dramatically since the early 1980s. I mean, when I was a child, you know, the slogan was go to work on an egg. Fantastic. That's what you'd all be doing. And that has now become supplanted by cereals, toast,
porridge,
fruit juice, carbohydrate, which is just the worst start to the day. And we naturally have a blood pressure spike in the morning. That's what wakes us up and gets us going. That's driven by hormones. And if we add to that even more, then you have a massive spike of sugar at the beginning of the day, and then you spend the rest of the day on the roller coasters, uppers and downers, with all the hormone fluctuations that follow in the wake of that. So yeah, the paleo ketogenic diet is absolutely the starting point.
And you know, it's lovely because you're referring this paleo ketogenic diet. That's why Sarah Myhill published an incredible book, which I really like. There are some great recipes in there as well. And you know what I really like? That you really put like really simple ideas. For example, like eating canned fish, you know, is a good source of protein and not many people think about it. That's why I really, really highly recommend to get this book. And it's actually quite a lot of information and there is quite a lot of different recipes. But you know what when I was listening to you about the healthy lifestyle and healthy eating, you know, I think we live in a society now where to eat healthy or to know what to eat healthy is really, really difficult because our food pyramid, I sometimes say, it's completely corrupted. Correct. It should be upside down because when you look at our food pyramid, there is a massive amount of carbohydrates. And as we know, too much carbohydrate spikes our insulin levels. And there are so many people nowadays who have insulin resistance. Again, no one ever checks their insulin. You know, they check the glucose And as we know, that's not necessarily the best way to check what's happening with blood sugar levels. And that's why when I look at the food pyramid, I sometimes have a feeling who created it? You know, is it the food industry? Is it pharmaceutical industry? Because it has nothing to do with a healthy eating.
Correct. Absolutely. I mean, if anybody wants to think about blood sugar, an incredibly useful device is continuous glucose monitoring.
Yeah.
And some of you may have heard the Zoe project where they offer that. Or you can just get yourself, it's called Abbott Freestyle Libre, I think is the best device. And you stick it on the back of your arm. It's very easy to do. And then you follow readings. If you've got a smartphone, it tells you. And it gives you a minute by minute view of what your blood sugar is doing. Because a one-off blood sugar doesn't tell us very much. I mean, it's like taking a photograph of a car and trying to say, well, how fast is it going? Well, you have no idea, do you? You need a video. You need continue, and then you can see exactly what your blood sugar is doing, what it's spiking in response to, what's falling, and you might find out that green tea is useful for bringing your blood sugar down. But what we want is the blood sugar as level as possible. Because as soon as the blood sugar starts to fluctuate, that then messes up all the hormones downstream of that. And it starts off with adrenaline, cortisol, DHEA, sex hormones, hormones of satiety, and so on. So we want the blood sugar absolutely level, and we achieve that very readily by doing a ketogenic diet. So if you're in any doubt, measure, because tests don't tell lies. And people kid themselves, I think I'm doing a good diet because I'm having. If you really want to know,
Yeah.
it's about 55 pounds, I think, and that gives you 2 weeks of continuous glucose monitoring, and that will give you a huge amount of information. So that's a very useful investment to make if you want to really know what's going on.
And it's so interesting because I had a couple of my patients using the device, and you know what they saw? That the oats porridge with some nuts and seeds in the morning was raising their blood sugars like crazy. And again, what are we recommending a lot of the times, even as nutritionists, we're recommending whole grain porridge, and I've been taught like that. But then during my practice, I realized the porridge is not a great thing in the morning. It's raising the blood sugar levels. But, like you've mentioned about the ketogenic diet, and I think the ketogenic diet gets a lot of press, and usually a lot of bad press, I would say. There are some people who are saying, oh, women shouldn't follow it because it's really bad for our hormones, and it can cause infertility. What are your thoughts and your experience?
Well, it's the old story. When you have a difficult question like that, go back to evolutionary biology. What did our bodies evolve to eat? Now, infertility has never been higher than it is now. And these are figures from some years ago. 1 in 10 couple now needs fertility treatments. Whereas, I don't think primitive woman had any problem at all getting pregnant. In fact, primitive woman was probably, my guess is primitive woman never saw a period. And she never saw a period either because she was too young, she hadn't had a child, or she was too old.
Yeah.
Or because she was starving. And when you are in a starved state, your periods stop. That's nature's way of saying you're not in a fit state to have babies. Or you were breastfeeding, because breastfeeding stops you producing period. Or you were pregnant. And, primitive woman would have been constantly in one of those states. So seeing a regular period is not normal. But I say infertility is going through the roof at the present, and that exactly parallels our declining quality of diet. Now, and as correlation doesn't mean causation. Just because there's a correlation between modern diets and infertility doesn't mean it's causal. But there are so many factors that to my mind, make it causal. As I say, poor quality diet, micronutrient deficient, and toxic stress from all sorts of pesticide residues in foods, heavy metal contamination, autoimmunity, da. So if we want to become fertile, we have to go back to evolutionary biology. We have to go back to first principles. Now, that doesn't mean I want to run around, half naked and rabbit loincloth in the freezing cold wind. No, I want all the luxuries of modern life. And I'm very lucky. I sit in my conservatory. I have lovely light, lovely views. I'm nice and warm. But with all the securities of modern life, I want a secure food supply. I don't want to be beaten up or raped by one of my neighbours coming across the hills. And poor primitive women would have been subject to that constantly. So we need to say get the best of both worlds, if somebody makes a statement like that, say where's the evidence base for that? And you may be aware of work by Margaret and Arthur Wynne, who published extensively in the Journal of Nutritional Medicine, clearly showing how that the nutritional status of the parents is the main determinant for fertility, healthy pregnancy, and a happy outcome to that. In fact, I wrote a book about this. It's called Green Mother, and that was based on my experience working with a very dear friend of mine. I'll just tell you the story quickly because it's a lovely story. When Michelle first moved into area, she's married, but had been trying for babies for some years with nothing happening. And she's one of those super bright people who I didn't have to teach anything. She immediately picked up the importance of the paleo ketogenic diet. We ate together, we gardened together, we socialized together, and within a few months of establishing it, she became pregnant and had a trouble-free pregnancy. But what's even more interesting is she raised both her girls on a paleo ketogenic diet. So Bobs and Etta, one is my goddaughter. Bobs and Etta were breastfed and now continue to eat a paleo ketogenic diet. Now the upshot of that was is they not once as babies burped or posseted or
Mm.
belched. They had perfect upper gut. And that's because, babies these days, either they're breastfed by mother who has lots of sugar in
Mhm.
her breast milk because she's eating sugars and carbs, or baby milks, which are terribly high in sugar. And so they have a fermenting gut, so they burp and
Yeah.
posset. I mean, I didn't know this when my girls were, I
Mm.
walked around with a permanent, white badge on my shoulder because the milk went down, up it came.
Yeah.
And the second thing is they both slept. From a
Mm.
few weeks of age, they both went to bed at 7:30, and Michelle had to wake them up at 8 o'clock the next
Oh
morning.
my goodness.
So Michelle never had
Yeah.
missed a night's sleep. She slept solidly through, and of course that gave her more time to
Mm.
work with food and so on. And better than that, they also slept in the afternoon. 2 or 3 hours of sleep. So they'd wake up and they'd have their black pudding and their sausage and their
Mm.
vegetables, and their eggs for breakfast, and then they'd have a busy morning and lunch, and then they'd sleep for 2 or 3 hours. And she had to wake them up at 4 o'clock in time for an afternoon play,
Yeah.
get their supper in, bath, all that, and then be back sleeping again at 7:30. And of course, that's what babies should be like,
Mm.
because primitive woman couldn't have been up all night and looking after them all
Yeah.
day. She had to go out and forage. And maybe she had to leave them in their cave or in a safe place where she went out and gathered
Mm.
food for the family. So having a baby that's screaming and crying and not sleeping is
Mm.
evolutionary disaster.
Yeah.
So just one little, vignette of how vital the PK diet is for pregnancy and breastfeeding, and how this is, and for modern life. Guess what? I can take anything the world throws at me, so long as I get a good night's sleep. I don't
Mm.
get a good night's sleep, I don't
Yeah.
function the next day.
And I think a lot of us don't. And I'm very grateful for sharing this experience you've had. And, I have a daughter who's almost 3 years old, and we've never gave her any sugar. Like, she hasn't had sugar. And then obviously, we are looked at a bit strange, but okay, I'm nutritionist. My husband is dietitian. That's why they're like, okay, we understand that's your belief system. But nowadays, we are the parents who are made to feel bad that we are doing something wrong, and
Correct. And there's a lovely film about this, starring my favourite actress, Meryl Streep, called Do No Harm. And this is based on a true story of a mother who had a little boy called Charlie, who was seriously epileptic. I mean, constantly fitting. And he went to the doctors, had all the drugs, nothing, didn't make any difference. He was fitting, getting sicker and sicker and sicker. And she read about how a ketogenic diet can cure epilepsy.
yeah.
So she said to the doctors, I want to put Charlie on a ketogenic diet. And they treated her as if it was a form of child abuse. She had terrible resistance amongst the medical. Oh, you can't do that. It's dangerous. It's toxic. All this tosh. Anyway, of course, once the little boy was on a ketogenic diet, his fits disappeared completely.
Yeah.
Off his drugs, off his medication, and now, growing normally. And on the back of that, there's a very useful website called Matthew's Kitchen, where they've got lots of recipes for keto. Bear in mind that the only problem about the recipes, they do include dairy products, and they do have quite a lot of sweeteners in them, and I'm not very keen on either of those. But there's some good ideas there. But the point is, yes, parents who don't let their kids have, processed food, sugar, a lot of are seen as somehow depriving their children.
I know.
And it's a shocking way to be about, because the parents who are feeding their children processed and junk food, that is child abuse. Why? Because they're going to get fat, and they're going to be fighting that for the rest of their lives. And even now, a few authorities are beginning to say, oh yes, the very obese child, that is child abuse. And of course it is.
But you see, it's so strange for me because, again, like I cannot not compare what's happening in Lithuania. And for example, when I was growing up, we didn't have desserts at school, for example. That wasn't a normal thing. And then nowadays, at schools, we have pudding. And we are teaching children to have pudding after every meal. And then another thing which concerns me a little bit, how veganism is being pushed on nurseries and schools. There are some of the nurseries who chose to go completely vegan. And as we know, veganism, you need to supplement the diet. You cannot be healthy on the vegan diet. And that's like, it's very strange to me, which direction we are going, especially with the nutritional advice. And, that we are choosing a burger which is made from 20 different ingredients rather than choosing a piece of red meat. That's like, let's cover a little bit the red meat topic, which is a big one, isn't it? Especially in Lithuania, I very often hear things, I love red meat, but red meat is bad for me. It's bad for my heart. It might cause me cancer. I should avoid it. My doctor told me to avoid it. So what are your views about it?
Okay. Well, first of all, with as far as its potential to cause disease, if sugar is that much, red meat is that much. Okay. So, the potential to cause disease is tiny. And then, of course, the paleo-ketogenic diet is not a high protein diet. It's not you have to eat 10 steaks a day. Yeah. It's a normal protein diet. And of course, meat, we are made up of meat, aren't we? My muscles are made up of meat, my bones. There's everything in meat to nourish the body. And there's some of my patients choose to do carnivore diets. In fact, I have a dear friend in Scotland, Dr. Rachel Brown. She's a consultant psychiatrist. She's been eating a carnivore diet for 4 years and she's perfectly healthy. And that is her starting point to treat her patients.
I'm so sorry. Could you explain what carnivore diet means? Because not maybe everyone who follows me might understand what that means.
A carnivore diet is when you only eat the foods that carnivores would eat, which would be meat, fish, and eggs.
What about the fiber?
What's so fascinating, and I'm ashamed to say I don't know the answer to this myself. And I asked Rachel this very point, but carnivores have as diverse a microbiome as do vegetarians. So that is fascinating. So there are fibers within meat which feed and nourish and allow us to develop a healthy microbiome. But I'm not quite sure why, because we're taught that the more diverse your diet, the healthier the microbiome is. And by diversity, I mean number of different foods. So diversity isn't a pizza one day and bread the other day. Yeah. Actually, that's all the same food, obviously. Yeah. And we should aim to eat 30 different foods in every week. And it doesn't have to be a plate of, just a slice of cucumber, onion, a bit of onion. So a good salad with lots of, and in my salads, I put sunflower seeds and pumpkin seeds and pulses and a tin of beans here and some anchovies there. There's lots in there. So the more diverse, the better. But carnivore is remarkably healthy diet. There's nothing unhealthy about it. I think problems arise with meat. One, if you're eating processed meat.
Yeah.
And in fact, I read an article about pork produced in America, and there's a chemical there, and I'm ashamed to say the name won't come into my head, but it's catechin or something, which is a known carcinogen. And now a law has been passed where pigs are not allowed to be treated with that. So if you got proper meat, and guess what? Our primitive woman would have eaten wild, grass-fed meat, and she would have feasted and fasted. You wouldn't have had meat every single day. You'd have had a day a week maybe when the tribe brought down a deer, and you'd have good meat. And then the rest of the week you'd have been picking around on this, that, and the other. And the third point about meat is it's the cooking of meat that's so often a problem, because if you heat fats to very high temperatures, then you will make burnt fats, you will make malondialdehyde, toxic fats, and trans fats. So the cooking is as important as well. But if you're eating a normal protein diet and you don't need protein every day, but you need a reasonable amount, and it's cooked correctly, and it's from the best meat you can possibly get, there is nothing unhealthy about meat whatsoever.
And I know, Sarah, that you are growing your own meat, isn't it? You have your own pork, I think, pigs, right?
Yes, now I'm very lucky. I have my own pigs, and I've got a bit of land out there, and I have grazing pigs. They're called Kuna pigs, so they're from New Zealand. They were developed by the Maoris, and they can get fat on grass.
Amazing.
So I have a rough area of about 7 acres. So most of their calories come from that. During the winter, yes, I have to top up a little bit with obviously I feed them organically. But I tell you what, the pork that comes from that is absolutely divine. And when you've had my sausages and my bacon and my pork, you never want to eat pork from another source again because it's tasteless by comparison. Now, I'm sure in Lithuania you have much better quality pork than we have in this country because we've got a big population in this country, and to feed that,
Yeah.
those animals are kept intensively. And intensive pork and intensive chicken is bad news. In fact, one other little clinical tip here. I've just been learning. I'm always on a very steep learning. And of course, I always get excited about things that I've learned most recently. So, but a lovely book by a wonderful American girl called Melissa Gallico, and she's written about acne. The first person to really crack the acne story was Lauren Cordain, who was the big advocate of the paleo-ketogenic diet. And what he observed in his travels around the world is that people living in primitive tribes, the incidence of acne is zero.
Non-existent. Yep.
It's non-existent. They all have beautiful skins, beautiful dental arches, and so on. Now, the author of this study, Melissa, like any patient, was asking the question why. She had very severe cystic acne. Now, she did the paleo-ketogenic diet to the letter and saw some benefits from that, but it didn't clear it completely. There was still some residual. And the missing factor was fluoride. And she worked this out for herself, clever girl, because during her travels around the world, she'd go in some places where her acne would clear completely and others where it came back in spades. And she couldn't work it out. And eventually the penny dropped. The linking factor was fluoride. And now she does a fluoride-free diet, so she doesn't have fluoridated water. Dental treatments full of fluoride, non-fluoridated toothpaste. Don't use Teflon, non-stick frying pans are full of fluoride. And many prescription drugs have got fluoride in them. So by dint of doing that and taking iodine, Lugol's iodine, now her skin is beautiful. It's completely clear from spots. And she's done a wonderful website, Hidden Cause of Acne. Do recommend you look at it. But back to chicken, because that's how I got it. The point about chicken is they have very high levels of fluoride in them and very high levels in their bones. So if you make bone broth or bone stock, which of course is a fantastic part of the diet, then it does need to be from organic. So organic. I can access organic beef bones online, as can anybody. I have a friend of mine who goes out deer shooting, so I get organic venison. Organic is increasingly important.
I would absolutely agree with you. And, a lot of the times I say, if you don't know where your meat comes from, you should be avoiding pigs and pork and chicken, because this is the meat which is going to be very high in omega-6 as well, isn't it? And then it's a much safer option to go with even commercially bought beef or lamb than pork or chicken. But it's upside down, isn't it? Because nowadays people eat so much chicken and then they barely eat any beef. And then I remember when we were driving in Scotland with my husband, and we went to a really small coffee place, and there was grass-fed burger for £5. I was like, I couldn't believe in the middle of nowhere, because of course in Scotland, all the meat is grass-fed, isn't it? It's just because of the environment and the landscape. And I just think that the message should be different. Eat more red meat, and eat less chicken, especially if you don't know where it comes from. Correct. And then your point about fluoride was brilliant. And I think, especially for people with thyroid problems, that's another thing, isn't it, where fluoride can mess our thyroid a lot, and especially if there is not enough iodine in our diet coming in. That's like, can we touch a little bit on the thyroid issues? Because that's something I see so often, and especially more and more younger people are developing it. And although thyroid problems, especially Hashimoto's, is associated with women, I think there are quite a lot of men out there walking with the Hashimoto's, but no one is testing them. Because again, it's a more female problem, isn't it? So what is your experience with Hashimoto's, and what do you think might be the cause, and especially in today's society, why so many people are developing it?
Okay. Well, Hashimoto's is autoimmune hypothyroidism. It's when
Yeah.
we make antibodies against self. And I think that the single biggest cause of autoimmunity are vaccines.
Mm.
We are using far too many vaccines. In America, by the time you become a teenager, you have received 68 different vaccinations.
Wow.
That is absolute disaster. And again, I know you can't, just because there's a correlation, you can't say that's causation. But this parallels the use of vaccines, and it's biologically plausible that vaccines should be driving autoimmunity. Not my words, but the words of Professor Yehuda Schoenfeld, who's written very much about the Asia syndromes, autoimmune syndromes induced by vaccinations. And vaccines, we don't need vaccines. We have survived throughout time because we have fantastic natural immunity, and we should be looking after our immune system, and the immune system will look after us. But yes, we are seeing epidemics of Hashimoto's, and that's autoimmune when we destroy our thyroids as a result of that. You also mentioned iodine and fluoride. Fluoride is extremely toxic element. It's very light. It's highly reactive. It will react with anything, and it's being added to our water. It's coming up in the food chain. We discussed all the sources of that. But yes, that will knock out the thyroid gland easily. And in parallel with iodine deficiency, and we are all iodine deficient, then that is driving epidemics of iodine deficient, fluoride toxic hypothyroidism. So yes, it's incredibly common. Now, the key point to remember about the underactive thyroid is you don't just diagnose it on a blood test. You diagnose it according to the clinical picture and the symptoms and signs as well. In fact, and the doctors, as we know, are extremely bad at diagnosing the underactive thyroid, and therefore it's often being missed. And worse than that, they only rely on blood tests and not the clinical picture to get the dose right. So I've been very naughty. I've written a book. I've called it The Underactive Thyroid. Do it yourself because your doctor won't. And that is the shameful but true fact of the matter. You have to take control of your own health. If you've got somebody like yourself who's an experienced therapist, then that is incredibly helpful. But we, as I mentioned earlier, all diagnosis is hypothesis. So if somebody comes with a clinical picture of the underactive thyroid maybe, and we hypothesize that that is the case. And then we go through all their symptoms and all their signs to see if that is possible. We do a blood test, and the primary reason to do blood tests is to make absolutely sure that person is not overactive. Yeah, I mean, they should present with different clinical pictures, but there can be overlap and it can be confusing. So once you've got a blood test that shows that there's biochemical scope for a trial of thyroid, and a clinical picture that suggests that person is underactive, then you start them on a trial of thyroid hormones. And the key here is to start with very low doses and progress very slowly, because it's all too easy to miss that sweet spot. It's all too easy to think, oh, this is the answer. I want to take a lot quickly to get well as soon as I can, and overshoot and end up overcooking things. And I detail how to do that in the book. But if you want to do a whole separate lecture on that, we can do a whole separate lecture.
Yeah. And I think that's what it is. Like, I would say, you mentioned about doctors usually only doing the bloods, and they usually look at the TSH, isn't it? Thyroid stimulating hormone, and it's not a good indication what's happening. It's only a small picture. And then I've had so many of my patients who would come up to me with really highly raised thyroid antibodies, and you know what their doctors would have told them? We don't need to do anything. Because your TSH is normal. And I'm like, look, your thyroid is under their attack. That's why we're going to sit and wait until your TSH is not normal. That's why I think that their education is not there. And then usually people, end up needing their thyroid to be removed because of the decisions which weren't made, earlier.
Correct. Yeah.
Yeah, and I think, again, going back to the fluoride, I always get asked about it. What about my teeth? And then I think Weston Price did an incredible work, isn't it? Looking at the teeth and everything. I haven't been using fluoride in my own toothpaste for about 25 years, and I have brilliant teeth. And I've been aware about fluoride dangerous for so many years. And if we don't have a very good filter in our home, we can forget about the filtering the fluoride, because it's actually very difficult
You
mineral
can't.
to get rid of.
Correct. You can't filter it out. It doesn't work.
Yeah.
As you right. So it's got to be fluoride-free water.
Yeah.
Is absolutely the starting point. And there are some drinks which are very high in fluoride, particularly tea. So if people drink a lot of tea, then they will have high levels of fluoride. And we know it's known carcinogen. We know it drives bone cancer, osteomalacia, acne spots. It's bad for our skins. It absolutely gets the thumbs down. So fluoride is an absolute no-no. It has no essentiality in the body whatsoever. It's not essential for the body. And the reason why fluoride got put in water is because it was a waste product from industry.
Correct.
How can we get rid of nasty, toxic, product from industry? Oh, I know. We'll put it in the drinking water. Is that sensible? I don't think so.
Yeah, and I think another thing where there is a massive myths around is fats. That's we've talked about the fluoride. I want to touch the big topics. That's saturated fat, pork fat, butter, ghee. Is that for us? Let's change it to, I don't know, sunflower oils and rapeseed oils. What is your opinion about this?
Well, the reason that this myth has been perpetuated is because the food industry love it and big pharma love it. So, high fat gives you high cholesterol, gives you heart disease. Rubbish, rubbish, rubbish. And these are not my words. These are the words of consultant cardiologist Dr. Aseem Malhotra, who wrote a book called The Statin-Free Life. Another wonderful book, Malcolm McKendrick, The Great Cholesterol Con. And cholesterol does not cause heart disease. In fact, the higher your cholesterol is, the longer you live. Cholesterol is the molecule that's responsible for healing and repairing our arteries. So when arteries get damaged, and what damages them? Sugar, high blood pressure, and of course, sugar and high blood pressure go hand in hand. Abnormal homocysteine, inflammation, and of course, vaccines drive inflammation. That's what damages our arteries. And cholesterol moves in for the business of healing and repair. Now, the most useful cholesterol to measure is the HDL, the so-called friendly cholesterol, because that is the one that's mainly used in the business of healing and repairing. So if your HDL is 2 or above, then that suggests to me you've got good levels, and therefore we can infer your arteries are not damaged. If you've got low levels of HDL, maybe 1, 1.2, 1.4, something like that, then that's low. That tells me your HDL is being used up in the business of healing and repairing arteries. So it's a symptom of arterial disease, not a cause of arterial disease. And from your HDL, you can get a pretty good handle on how good your arteries are. Are they in good shape or otherwise? So, and of course, fat is the perfect fuel for mitochondria. It's, it does not damage arteries. It's good for arteries. It's sugar and blood pressure that damages arteries. Those are the killers. And those are the things we have to avoid. So that's why a paleo diet is rich in fat and fiber. It's normal amounts of protein, some carbohydrate. Yes, you can't live life without any carbohydrates, but we can get all we need from good vegetables and nuts and seeds and so on.
What do you use yourself? What sort of fats do you use yourself in a day-to-day cooking?
I'm very lucky. I've got pigs, so I cook largely with pig lard or coconut oil. In fact, I do sometimes eat chips, with potato, which, yes, it's high carb. But in order to get the carb content of the potatoes down, what you do is parboil them and then let them cool, and that converts them into resistant starch. And then I fry them in coconut oil, which just gives them the most lovely, crunchy texture. And, I only have to have 3 or 4 of those and I'm completely satisfied. It doesn't spike my blood sugar. I'm still in ketosis and so I can enjoy a few chips. Because the one thing that people often complain about with the PK diet is the crunch factor. Because having crunchy things is nice. So I'm always looking out for crunchy foods like, good salads. Crunchy chips are, a great way forward.
And I think because you have pigs, you could make your own pig puffs, like pork puffs.
Absolutely. It's the high point. Yeah, it's a high point. So, I mean, I don't know what you do in Lithuania, but we we don't skin our pigs. The Americans skin their pigs. We just take the bristles off, and that skin makes the most delicious. We call it crackling.
Yeah.
So we take the skin off with a layer of fat, cut it up into pieces, and then I put it into a pan, render the fat down for cooking, and what's left are the crunchy, crackling bits, and these are delicious.
I make it at home. I can admit, nutritionist is making pork crackling as well, because it's really healthy. It's so high in collagen. Nowadays people are buying collagen supplements. That's your collagen supplement, and then it tastes great, and it has this crunchiness which you are talking about. I absolutely agree with you. Then how long you've been following PK diet? Because obviously you haven't been doing that all your life, isn't it?
Well, my evolution was, it was in 1982 that my daughter was born, and that's when I realised dairy products were a real problem. And then through working with people who had allergies, I realised that grains, gluten grains, and yeast was also a problem. So my diet started off low allergen, and of course I was well with that. But I realised that didn't tackle the big problems, the high blood pressure, the diabetes, the dementias, the big pathology. And that's when, the dawning realisation that carbohydrates are important. And of course, I started off by looking at the work of Atkins, Dr. Atkins, who demonstrated that low carbohydrate diets was the most efficient way to lose weight. And of course, obesity is a major problem. Obesity per se drives pathology. And then, so I got interested in Atkins, but of course, Atkins is high in dairy products, and they also allow sweeteners, which I'm not very keen on because that keeps the sugar craving going. Yeah. So then it evolved. And then I remember sitting down one day and thinking to myself, don't go all that, just go back to first principles. Yeah. Or what are first principles? And first principles are, we evolved over hundreds of thousands of years eating a paleo diet. And I suppose it was Lorraine Cordain who really kind of flagged this up. It's got to be low sugar, no processed foods, I say no grains, no dairy, and then we can build on that. Now, people say to me, "Oh, isn't it a boring diet? Because you're eating the same stuff." Now, the people who eat the boring diet, the people who are eating Western diets, because they're having wheat, but just put in different shapes or forms. It's pizza, bread, crackers, pasta, pastry. It's all the same stuff. It's all wheat. They're eating the boring diet.
Yeah.
Whereas, say, my diet, there's pulses, there's nuts, there's seeds, there's salad, there's all sorts of vegetables, and then as many different meats as I can. It's a really interesting diet. But what I really like about the paleo ketogenic diet is I never get hungry. So, I don't eat breakfast. I try to time limit my food, so I have all my food within a 6-hour window of time. And, I shall have my lunch at 1 o'clock or 1:30. But, I've got another interview to do at 2 o'clock. If I didn't have lunch, it doesn't matter. I don't run out of energy. My brain stays sharp. And it just means I will enjoy my evening meal even more. A very dear friend of mine, Dr. Ahmed Malik, who runs a very good podcast channel, he came from Pakistan. His whole family moved to Scotland. And he said, when we first moved, of course, we ate traditional Pakistani food, which was low glycemic index. They were all slim, they're all fit, they're all healthy. And then he said in the 1980s came along, the sugar revolution, and Mars a day helps you work, rest and play. So got to have Kellogg's cereals for breakfast, all that tosh. And the whole family got fat. And they all got diabetes, including Ahmed. And he treats that, he eats a PK diet, but he only has one meal a day. He just drinks water, and he's slim, he's fit, his brain is sharp, he runs every day, he's got 3 small kids, and he's as healthy as can be. And that's what we should be doing.
And I think that's what it is. So often I even tell my patients, let's eat 3 meals a day. Because trust me, for some of them, it would be good to eat 2 meals a day. But that's already a reduction from 7 meals a day, because there is this myth that there needs to be 3 meals a day, 2 or 3 snacks. We are constantly snacking. And then what are we doing by snacking? Raising our insulin. And what does the insulin do? Stores everything. And it's this cycle that I think a lot of our digestive health problems are caused by constant snacking.
Absolutely, because that leads me on to my another favourite subject of mine, is if we're constantly snacking on sugars and carbohydrates and whatever, we overwhelm the ability of the upper gut to be sterile. Now, the upper gut, by which I mean stomach, duodenum, jejunum, small intestine, the first 22 odd foot of gut, should be near sterile for the business of digesting meat and fat and some carbohydrates. Now, if we're snacking all the time and it's fruit juice and chocolate and crisp bread and all sorts, then the upper gut becomes a fermenting gut, and that is a disaster. Because when you ferment foods, first of all, you produce a load of toxins. So if you ferment sugar, you produce alcohol. And if I ate half a pound of grapes, then you're inoculating the upper gut with sugar and yeast, and it will ferment very quickly. And what do you produce? Alcohol. It's called the auto-brewery syndrome. And alcohol gives you a foggy brain and makes you fatigued. But it's not just ethyl alcohol that can be produced by fermenting sugars and carbohydrates. It's propyl alcohol, it's butyl alcohol, it's hydrogen sulfide, it's ammoniacal compounds, it's D-lactate, it's a whole range of toxins, and these poisonous. And then the microbes themselves cause problems, because if you've got bacterial fermentation and yeast fermentation, they produce their own toxins, yeast, mycotoxins, bacteria, bacterial endotoxin, and that poisons us. But worst of all, the microbes themselves can get into the bloodstream. And when they're in the bloodstream, the immune system is activated against them, and you drive inflammation wherever those microbes end up. And I'm quite sure that arthritis, like osteoarthritis, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, is all driven by allergy to microbes from the fermenting gut. Ditto fibromyalgia, ditto intrinsic asthma, ditto inflammatory bowel disease, ditto polymyalgia rheumatica, ditto temporal arteritis, psychosis. All these pathologies are driven by allergy to microbes from the upper fermenting gut. So how do we treat that? Well, first of all, stop feeding them. We do a ketogenic diet. And secondly, we kill them with vitamin C and iodine. And vitamin C and iodine are two of my favourite multitasking tools because they're cheap, easily available. The potential harm is virtually zero. They contact kill all microbes. The only thing to remember about them is don't take them together, because one is a reducing agent, the other is an oxidizing agent, and they knock each other out. So either take iodine, 3 drops of 15% Lugol's iodine first thing in the morning on rising, and vitamin C later in the day, or the other way around, whichever suits. Everybody's different. But if you do that, you then clean up the upper fermenting gut. And a whole heap of health problems fall away as a result of that.
Because in a way we have this saying, we are what we eat, but I sometimes change it. We are what we are able to digest as well. And I think that's why it's so important. It's not about how many times per day do we eat. The less, the better, but then what actually we eat and how we are able to digest. Then just to summarize everything, because I know the time is, oh my goodness, I could probably speak with you for a couple of hours, but just to summarize, your recommendation would be to follow the PKD diet, which is low carbohydrate diet, moderate amount of protein and high fat diet. And if I understand correctly, would that be suitable for everyone?
Correct. Babies, children, it's never too late to start. And there's a Chinese saying by philosopher Confucius, if you unless you change the direction which you're going, you're likely to end up in the direction that you're pointing. And carbohydrates diets, you're heading for the rocks. Diabetes, obesity, cancer, heart disease, and so on. Change now, so that ship is sailing out into clear waters again, and avoid all that pathology. And it's never too late to start, and we should all be doing this.
And I think one more thing I want to touch, you've mentioned about vaccines a couple of times, and I just want to clarify a little bit, because I'm sure there's going to be parents who are listening to that, and they might have questions. What do you mean about the vaccines? Does it mean that children shouldn't be vaccinated, And we have so many vaccines. I have a daughter who's 3, and I'm getting the reminders to give her a flu vaccine, every week or so. And I'm like thinking, I wish you would remind me about other things so often. That's like, what is your view about children vaccines?
Well, 2 points. First of all, when I was researching the book Green Mother, and also another book I wrote called The Infection Game, I realized that natural remedies for acute infections work fantastically well. So what really brought down the incidence of infectious disease in the modern world is not vaccination. It was good hygiene. And the reason why so many children died in the 1800s and the 1900s and the early 20th century is because they had poor nutrition and they were living in filthy conditions. They didn't have clean water, they had no proper sewage runoff, and so on. And when the Victorians and the Edwardians put in good modern hygiene systems of hygiene, the rate of infectious disease came down to virtually nothing. And there's a wonderful book I recommend called Dissolving Illusions. And if you want to read about that, then please do. So vaccines came, so the rate of infectious disease was already coming down, and vaccines only came in at the very last moment. So their overall impact of vaccines on death rate from infectious disease is tiny. That's the first point. The second point is, in addition to the paleo-ketogenic diet, tools like vitamin C and iodine, well used, are incredibly effective against all these infectious disease. The third thing is, we are supposed to get chickenpox and measles and mumps when we are children. Why? Because that educates the immune system. It trains it. And what we now know is that children who get acute febrile diseases as children are protected later on in life from cancer, heart disease. So having an acute infectious disease and allowing the body to respond normally and naturally to it is totally desirable. What we don't want is, sick, malnourished kids, with, of course, they obviously are going to be at risk, but vaccine is not going to stop them dying from that disease. It's good hygiene and good nursing care is going to. So when I discovered all that, I realized increasingly that vaccines are becoming irrelevant. Increasingly so. And I'm also mindful that we now know that vaccines drive a huge amount of pathology. And if you want to look at the cover-ups, then a very easy way to do it is watch Andrew Wakefield's film called Vaxxed, which is free. Anybody can access it, and that is wonderful. I'll just give you a very quick history of vaccination, if you can bear to hang on.
Oh, yeah, definitely.
There are other reasons why we shouldn't vaccinate. Now, the polio vaccine. Let's start with. It started with polio vaccine because there was risk of children getting polio in the 1930s and the 1940s, which we know can be a devastating disease. And so there's a race to develop the first polio vaccine. And this was spearheaded by a Polish doctor called Dr. Koprowski, who was working out in West Africa at the time. Now, the only way you can grow a virus vaccine is on animal tissue. You can grow bacteria on sugar and water, that's no problem. But viral vaccines have to be grown on animal tissues. And they were growing polio virus on monkey kidneys and then mashing it all up and injecting into children. Now, monkeys have their own endogenous retroviruses. We all have our own endogenous retroviruses. Humans have them. They're called HERVs, human endogenous retrovirus. But so do monkeys. They have their own simian endogenous retroviruses, including one which is called simian immunodeficiency virus, SIV. And when they injected hundreds of thousands of African kids with this monkey kidneys, that virus jumped species and became HIV. So the point here is that human immunodeficiency virus, i.e. AIDS, originated in Africa and is a man-made disease. If you have any doubt, read the book by Edward Hooper called The River. Now, when the powers that be discovered that, said, better not grow things on monkeys, we'll grow it on bovine tissue instead. So in the 1980s and the 1990s, vaccines were grown on bovine tissue. And then BSE came along. And the real worry of BSE was not that eating beef would give you CJD. That was nonsense. And even the powers that be knew that from the beginning. There's no experimental precedent for that. But the problem was they were growing vaccines on and we were injecting that into our kids. So, we will have given some children Jakob-Creutzfeldt disease. It has a very long incubation, one documented case up to 38 years. So it may be some years before it becomes apparent that that's what we've done. But at that point, the authorities said, well, we don't grow it on beef anymore. We'll grow it on mouse tissue instead. So then all viral vaccines were grown on mouse tissue until Judy Mikovits came along. And Judy Mikovits, viral researcher in America, demonstrated that 69% of patients with ME tested positive for mouse retrovirus, XMRV, 30% of men with prostate cancer tested positive for mouse XMRV, compared to about 6% of the normal population. And as a result of that research being published, she was thrown in prison.
Wow.
And all her co-authors said, "Oh, we didn't really mean that. Yeah, no." They retracted. But this is why there's been a drive to bring on the messenger RNA COVID vaccines, because you don't have to grow those on tissue cultures. They're very cheap to produce. Using PCR, you can increase it very rapidly, but they have not been properly tested. And we are now seeing these mRNA so-called vaccines. They're not vaccines, they're gene therapy being rolled out, and they are genetically modifying us as human beings. And they are programming ourselves to make spike protein. And spike protein is markedly pro-inflammatory. And that's why we're seeing so much myocarditis, endocarditis, pericarditis, and blood vessel inflammation with these new COVID vaccines. So the point is, if we get everything else in place, we eat a healthy diet, we have good micronutrients, we live in hygienic circumstances where we're not drinking dirty water all the time, then it means vaccines become almost irrelevant. So what I say to people is, do your own research, take control, work it out for yourself, and don't allow yourself to be pressurized by government propaganda and narrative.
And I'm sure there are people who would be listening and they would be thinking, oh goodness, I've already done COVID vaccines or some other vaccines, and maybe my health went the downhill afterwards. Are there any tips people could do to kind of cleanse the body from the side effects of the vaccine?
Well, all the things that we've been talking about, because these vaccines drive inflammation, and all the things we've been talking about help to reduce inflammation in the body. But it's like saying, somebody had a hit on the head, 20 years ago. I can't prove that smack on the head caused what they've done now. It's been and gone. All we can go with is what's biologically plausible and that which makes sense. And the clinical picture of vaccine injury is now huge. I've just been looking at Dr. Mark Trosey, who has produced a collection of 1,000 papers now showing how the COVID vaccine causes pathology. So the evidence is now irrefutable.
I saw this very, very small study of a woman who potentially developed aplastic anemia after COVID vaccine. And, that's crazy. She might need, a bone marrow transplant. And then in the end, it was written that it's inconclusive, but it's inconclusive. And I'm just thinking, okay, what do you think about fasting? Because there is a lot of health professionals who are saying potentially fasting, and especially longer fasting, might help for our body to get rid of it.
Correct, because when you fast, you switch on autophagy or self-eating, autophagy, however you want to pronounce it. And so the body needs a protein. And if you're fasting, there's no protein coming in, so it'll look around for other sources, and it will then mop up all the proteins that are floating around in the bloodstream, like bits of cellular damage, bits of DNA, bits of RNA, bits of spike protein, and it will grab those in order to create new amino acids. So yes, fasting is very helpful to switch on autophagy. It's a very well recognized treatment for cancer, for example, for the same reasons. And this is why I think that as we age in particular, it's a good thing to do time restricted eating, because if you're in ketosis and you are time restricted, you will switch on a window of time of autophagy every single day of your life, and then maybe have once a year do a 3-day fast or something like that. Everybody's different, but yes, fasting is a fantastically useful tool. And once you're in ketosis and not really on sugars and carbs, it's easy to do.
Easy.
And I occasionally do fast days. And guess what? On fast days, I don't have to go shopping. I don't have to go cooking. I don't have to lay the table. I don't have to do any washing up,
Yeah, which is great. Yeah. And, I love fasting. Me and my husband definitely fast. Obviously, we still need to cook for our little one, but it's such a great remedy. And especially if I'm sick and I'm unwell, I always fast, because I know that that's the best thing for our body. And even with my daughter, I try not to give her many snacks, or when she's unwell, I allow her to have a temperature, and my daughter goes to about 40, but then she gets well really quickly because it's her body dealing with it, fighting it. That's but I know, like we've had a couple of times where we're like, oh, shall we do something about it? But usually she just fights it off. And I love what you've been saying about the vaccines and how important it is that the foundation would be right. What we are not advocating that, we're eating a noble Western diet, and then we're not looking after ourselves. Because obviously, if we're not looking after ourselves, when we get sick, our immune system is weak and it might not be able to fight properly. That's why it's the combination of everything. But I think nowadays we've learned to rely on the pill. I call it a magic pill, and that magic pill usually doesn't come without side effects, and it doesn't give a solution long term. Yeah.
Spot on.
I'm so grateful, Sarah, for answering so many questions. I think we haven't even managed to cover everything what I wanted, but I think it was a very good indication where people could start. And again, I would like just to say one more time, it's a great book. If you want to learn more about paleo ketogenic diet, really good book to get and read it. Thank you so much. And I'm sure we'll do maybe another one in the future, and we'll try to cover some other topics again.
Perfect.
Okay. Thank you.
My pleasure. Bye-bye.
Bye.